Okay, so I want you to picture this. It's wonderfully inefficient, right? You take your car to the mechanic. Why? Because you've got this one annoying squeaky wheel. That's it. That's the whole problem. It's, manageable, but it drives you absolutely nuts. So you pick the carburetor, squeak, gone, perfect. But the mechanic has also, completely by accident, repainted your entire car. And it's this gorgeous, bespoke, metallic blue. You didn't ask for it, didn't pay extra, but hey, problem's fixed, and now your car looks amazing. Totally unintentional upgrade. What if medicine worked like that?
Well, that's actually a pretty great analogy for how some scientific discoveries happen, especially when you're targeting one tiny thing.
Right.
And suddenly the treatment spills over and fixes something totally different, and often something much, much bigger.
Exactly. Which brings us to today's topic, vitamin D. And look, we're not talking about the boring, drink your milk, don't get rickets vitamin D, no.
No, definitely not that version.
We're talking about the vitamin D that apparently got, bored with just managing bones, and decided sometime around the late 20th century that it wanted to run the entire immune system, the whole show.
Yeah, we're diving into some really interesting research today. It supports these protocols that are, well, highly successful but completely unconventional, especially for tackling the roots of chronic autoimmune disorders. And this isn't just, taking a supplement.
Right. This sounds different.
It's more like high-dose hormone replacement therapy, functionally speaking.
Okay, let's unpack that. We need to start with the origin story here, the accidental discovery bit.
Yes.
So years ago, there's this neurologist. He's diligently trying to help a patient with Parkinson's disease, trying to slow it down.
And his thinking was perfectly sound based on what was known. He knew vitamin D induces something called neurotrophic factors in the brain.
Which are, for those of us playing along at home.
Right. They're basically proteins. They encourage your neurons, your brain cells, to grow and survive. Good stuff for Parkinson's, theoretically.
Makes sense. Keep the brain cells happy.
Exactly. So he's working within that framework, brain health. And he decides to give this patient 10,000 IUs of vitamin D daily.
10,000 units. Okay, that sounds like a decent amount, but maybe not completely crazy for a neurologist back then.
Yeah, respectable. A solid neurological dose for the time, but not, off the charts.
Okay, but here's where it gets really weird and interesting. This same patient, completely unrelated to the Parkinson's, also had vitiligo.
Right, the autoimmune condition that causes those white patches on the skin.
Yeah, and this patient had it specifically on his forehead. Had it for years, apparently, just part of his life.
So the patient comes back for a follow-up. They're supposed to be talking about the Parkinson's progression, right? But the neurologist is just stunned. He looks at the patient's forehead.
What did he see?
The vitiligo lesions were almost gone, vanished. So the neurologist asks, what did you start using for the vitiligo? Some new cream? A pill?
And the patient says...
The patient just looks at him, probably confused, and says, nothing. I just took that vitamin D you gave me.
Whoa, that is exactly the car coming back, Lou. You try to tweak the brain wiring and you accidentally tell the immune system, hey, maybe stop attacking the skin pigment cells.
It was the ultimate, wait a second, what are we missing here? moment, seriously. It just signaled that this simple nutrient, which, let's be clear, functionally is a powerful steroid hormone, was doing some major widespread immune regulation that we hadn't really clocked.
Yeah.
And that really kicked off a huge paradigm shift. Or, well, it should have. Frankly, a lot of traditional medicine still seems to be catching up.
Which leads us nicely into vitamin D's big identity crisis, right? Because the standard medical view, the textbook stuff, it's all bone health and calcium metabolism. It's stuck on preventing rickets.
And look, that part is true. It does prevent rickets. But that's like saying a smartphone is only good for making calls. It's just a tiny fraction of the picture.
So what changed? What was the big reveal?
The game-changer discovery really came into focus around 1988. Scientists suddenly realized the vitamin D receptor, the little docking station on cells, wasn't just in the gut and bones and kidneys, the calcium places.
Where else?
Pretty much everywhere. Nearly all of the cells in our bodies have vitamin D receptors.
Wait, hang on. All of them? You mean like muscle cells, immune cells, brain, pancreas, the works?
The works, exactly. And if the receptor, the lock, is everywhere.
Then the key, vitamin D, must be doing something everywhere.
Precisely. And what it's doing, especially in the immune system, is acting like the master calibrator, the great balancer. It basically tells those overenthusiastic inflammatory T cells when to chill out, when to stand down. It helps prevent friendly fire.
Which is literally the definition of autoimmune disease, friendly fire.
Exactly. Your immune system attacking your own tissues. Vitamin D seems to be crucial for preventing that, or at least dialing it way down.
Okay, so it's not just about getting fewer colds. Problems with demetabolism can actually set you up for these chronic systemic diseases. But you mentioned something else. For people who already have autoimmune conditions, it's not just deficiency, it's resistance.
Yes, and this is probably the most critical piece for understanding the high-dose protocols. Resistance. We're talking about genetic factors here. Tiny variations in your DNA code called polymorphisms. SNPs, sometimes they're called.
Polymorphisms,
Oh.
okay. Like little typos in the genetic instruction manual.
Sort of, yeah. Common variations. And these little variations can affect up to 9 different genes that vitamin D relies on to do its job properly. They can affect the receptor itself or the enzymes that activate the vitamin.
So let me see if I've got this. If you have these polymorphisms, it's like the lock on your cell. The vitamin D receptor is maybe a bit bent or rusty.
That's a perfect way to put it. A broken keyhole. The key, vitamin D, doesn't fit quite right or doesn't turn smoothly. So even if you have technically normal vitamin D levels circulating in your blood.
Your cells can't actually use it properly. They're resistant.
Exactly. Metabolically resistant. The signal isn't getting through effectively.
Okay, so if the door's sticky, you can't just jiggle the key gently. You need to put some muscle into it, shove it in, and turn hard.
You got it. And that's where these dosage numbers start sounding, frankly, shocking compared to the little 1,000 IU pills you buy at the drugstore.
Yeah, because the standard recommended daily allowance, the RDA, that's just for preventing outright deficiency, like rickets. It's not designed for this genetic resistance problem.
Not at all. To get a real therapeutic effect, to actually overcome that resistance and make the cells listen, you essentially have to brute force the signal, overwhelm the faulty lock system, so to speak.
Brute force.
Okay.
Yeah. Give me the numbers. How much brute force are we talking? Like for an average adult with, say, MS or lupus.
Okay, so the average daily dose that seems to work in these successful therapeutic protocols is around 1,000 international units per kilogram of body weight.
1,000 per kilo. Okay, do the math for me. Say, someone weighs 185 pounds?
Right, 185 pounds is about 84 kilograms. So 84 times 1,000, you're looking at roughly 80,000 IUs. 80,000 per day.
80,000. Okay, hold on. That sounds
Yeah.
insanely high, like dangerously high. If I walked into my regular doctor's office and said I was taking 80,000 IUs a day, they'd probably tackle me and call poison control. Aren't we talking about turning into a talking calcium deposit? Hypercalcemia.
That's the immediate and very valid safety concern. And you're right, hypercalcemia, too much calcium in the blood, is the primary toxic effect, and it can be very serious. But, and this is crucial, it's entirely manageable if you understand the mechanism and monitor carefully. These protocols aren't casual.
Okay, so how do they dodge that bullet? How do you take that much D without your calcium going haywire? Is it just constant blood tests?
Monitoring is key, yes. But the main strategy is actually dietary. It's about controlling the input. Remember, vitamin D's big job related to calcium is massively increasing how much calcium you absorb from your food.
Right. It cranks up the absorption in your gut.
To 11, exactly. So if you take 80,000 IUs of D and keep eating tons of dairy, fortified orange juice, calcium supplements, yeah, you're going to get hypercalcemia, guaranteed.
So the trick is?
You have to cut way back on the calcium you're eating. Patients on these high-dose protocols are usually told to strictly limit or often completely eliminate dairy products and other high-calcium foods.
Oh, okay, that makes a weird kind of sense. It's not the vitamin D itself that's directly toxic at that level. It's the combo of high D plus high calcium intake. You manage the intake because the D has made you hyperabsorbent.
You've got it. Control the calcium coming in, and the risk plummets.
Yeah.
But there's one more piece. A vital cofactor.
Let me guess. Magnesium.
Bingo. Magnesium is absolutely essential here. It's like the co-pilot for vitamin D. See, the enzymes in your liver and kidneys that actually activate vitamin D into its usable hormone form, they require magnesium to work.
So if you're low on magnesium,
If you're low on magnesium, your vitamin D metabolism just stalls out. It doesn't matter how much D3 you take, even 80,000 IUs, if you don't have enough magnesium, you can't activate it properly.
wow. So low magnesium can cause vitamin D resistance too, even separate from the genetic stuff.
It absolutely can. It's another layer of potential resistance. So supplementing with magnesium is standard practice in these protocols. It helps regulate the calcium, yes, but it also ensures that huge dose of D3 actually gets turned on and used by the cells, makes the whole system run smoothly.
Okay, this is a lot. So vitamin D isn't just for bones, it's the immune system's master regulator. And for autoimmune issues, You might need these massive personalized doses to overcome genetic resistance, carefully managed with diet and magnesium. That's huge.
It really reframes how we think about nutrient therapy.
Okay, so that's managing the internal environment. Yeah, let's pivot. Let's talk about when the immune system gets messed up by something from the outside, something toxic.
Right. We're shifting gears now from the sunshine regulator
Yeah.
to something a bit darker and shinier.
We're talking about aluminum, aren't we?
We are. Now, look, this whole area, the connection between aluminum, especially from vaccine adjuvants and neurological issues, it's definitely controversial in mainstream medicine, very debated.
Understood. But the research we looked at presents a pretty clear theory based on actual tissue analysis.
It does. And the core idea is about what happens when aluminum is injected, often as that adjuvant, the thing designed to provoke a stronger immune response. Unlike aluminum you might ingest, which is poorly absorbed, injected aluminum isn't easily filtered out by the kidneys.
So it sticks around.
It sticks around. And worse, according to this research, it gets picked up and carried by immune cells, macrophages specifically.
Yeah.
And where do those macrophages sometimes go? Straight into the brain, across the blood-brain barrier.
Oh, wow. So it's like a Trojan horse situation. The immune cell carries the toxic metal past the brain's defenses, and once it's in there, it's not just causing temporary inflammation, it's lodging there, like a permanent toxic guest.
That seems to be the finding, physical toxicity, which is why the research looking at conditions like autism is so compelling, if unsettling. There was specific work done accessing brain tissue samples post-mortem, obviously from individuals diagnosed with autism. Samples came via a major university brain bank in England.
And they found
significantly high levels of aluminum nanoparticles embedded deep within that brain tissue, much higher than in control tissues.
Yikes. Okay, so from this perspective, something like autism isn't just potentially autoimmune, but also a direct result of toxicity. This retained aluminum causing ongoing metabolic chaos in the brain.
That's the proposed model, yes, a dual diagnosis. Autoimmune features potentially triggered or exacerbated by underlying metal toxicity.
And this isn't just about early childhood stuff. The sources suggested a parallel between rising rates of, say, adolescent depression and anxiety, and the increased use of aluminum-containing vaccines from the mid-2000s onwards.
Yes, that correlation was noted. Tragic if the link holds true.
Okay, but here's where it gets slightly less bleak. There's an anecdote in the material that's just yes. It cuts through all this complexity about toxicity and immune dysfunction with such a simple, almost unbelievable solution. Tell us about the 17-year-old girl.
Right. So this young woman, 17 years old, severely depressed, like really struggling. She was born in 2006, putting her right in that time frame of increased potential aluminum exposure from vaccines. And apparently she'd been on antidepressants since she was just 4 years old.
4 years old. Wow. So clearly, standard treatments weren't fully solving the problem.
Not at all. So the specialist looking at her case, considering her history and the chronic non-responsive nature of her depression, started to suspect aluminum toxicity might be playing a role.
Okay, so what do? Some kind of hardcore intravenous chelation therapy. Sounds complicated and risky.
Nope. That's the amazing part. The specialist decided to try giving her silica.
Silica, you mean like sand? Or those little packets in beef jerky bags?
No, not the desiccant packets. We're talking about orthosilicic acid. It's a bioavailable, soluble form of silicon found naturally in some mineral waters and available as a trace mineral supplement.
Okay, orthosilicic acid. How does that help with aluminum?
It's actually quite elegant. Silica, or silicon in this form, has an incredibly high binding affinity specifically for aluminum. It acts like a targeted magnet.
It just grabs onto the aluminum.
Yes, it binds tightly to the aluminum atoms floating around in the body, forming a compound aluminum silicate. And this compound, unlike the aluminum on its own, can be easily and safely filtered out by the kidneys and excreted in urine.
Get out. So the silica basically chaperones the aluminum out of the body through the normal elimination pathways.
That's the mechanism. A clean sweep for a substance the body otherwise struggles to remove, especially once it's lodged in tissues or inside cells.
Okay, so what happened to the girl? The 17-year-old with severe depression.
The outcome was pretty astounding. After about a year of taking the silica supplement, her depression was reported as being almost gone, like 85% better.
85% after all those years.
Yes. And crucially, her psychiatrist, who was working alongside the specialist, was able to gradually reduce and eventually discontinue her antidepressant medications. She simply didn't seem to need them anymore.
That's incredible. A lifetime of medication-resistant depression potentially turned around by a simple mineral binding to a toxic metal.
It really underscores the difference, doesn't it, between just managing symptoms, which is what the antidepressants were doing, and identifying and removing an underlying cause in this case, suspected toxicity.
Whether it's a nutrient issue needing huge doses or a hidden toxin needing removal.
Rah.
Wow.
Exactly, root cause approaches.
Okay, so let's try and synthesize this for everyone listening. We've hit on two really big kind of revolutionary ideas today. First, this whole vitamin D situation.
Yeah.
It's not just the bone vitamin. It's like the immune system's supreme commander.
Right. The master regulator.
And in autoimmune diseases, because of this genetic resistance, these sticky locks, you might need dramatically higher personalized doses. We're talking maybe 80,000 IUs a day, carefully managed, of course.
Correct. Overcoming that resistance is key. And managed with diet, managing calcium, and ensuring enough magnesium.
Okay, and then the second big takeaway, this potential role of retained toxins, specifically aluminum, in chronic conditions, even neurological ones, and the idea that simple, accessible substances like silica might help the body safely detoxify these elements, leading to potentially profound improvements in health, like we saw with the teenager's depression.
Yes, recognizing and addressing toxicity as another potential root cause, alongside nutritional factors.
What blows my mind, though, the thing that makes you feel like you've stumbled onto some secret knowledge, is how much solid research seems to exist on these things. The vitamin D receptor being everywhere, the aluminum toxicity links, the silica mechanism, yet it's often just absent, missing from standard medical training, textbooks, conferences.
It's true. It's information that is out there, and it is being used successfully by certain practitioners who dig deeper, but it hasn't filtered into mainstream standard of care protocols universally. So, yeah, you listening are kind of getting access to info that many doctors, frankly, just haven't been taught yet.
It really makes you wonder, doesn't it? If something as basic as the sunshine vitamin is secretly running almost every cell in your body, and a simple mineral can potentially help clear out a stubborn environmental toxin, what other massive secrets are just hiding in plain sight? What else are we missing? Just waiting for a brave doctor or maybe just a friend with a really good research paper to finally spill the beans?